In the previous video, we already looked at the question of what effects cancer therapy can have on later fertility. And you know now, the treatment can sometimes lead to it being more difficult later to have children of your own. Because some cancer therapies, especially certain chemotherapies or even radiation therapy, can damage the function of the testes. So how high the risk is that your own fertility will be affected, that depends on several things. For example, on the type of cancer and on which cancer therapies are used. But there are ways so that boys still have the best possible chances of fathering their own children even after cancer therapy. Whether these options are possible, however, also depends on whether you as a boy are already in puberty or not. And what is also clear, of course, is that you have a lot of other things on your mind right now. Yeah, and the topic of wanting children later, it probably still seems very far away to you now. As a young person, you might not even know yet if you even want to have children one day. Very understandable, but this is also why it's important to deal with it before the therapy or before the start of therapy, and to take precautions if necessary. Because that way, you as teenagers or parents can keep this decision open as much as possible. And by the way, the procedures we're presenting here for boys who are already in puberty are also covered by health insurance in several countries. So now, let's take a closer look at that. So, what can be done to preserve fertility in boys? That also depends primarily on how far the body has already developed. If a boy is already in puberty, usually from about 12-13 years old, then the body is already producing sperm. In this case, you can have sperm frozen before starting cancer therapy. This is also called cryopreservation. For this, a sample of seminal fluid is provided, which is what is produced during an ejaculation. The sperm is usually obtained through masturbation, that is, through self-stimulation, just like with a normal sperm donation. For this, you go into a private room in the clinic where you are completely undisturbed and have your privacy. Then it continues like this. The sample is examined in the lab to see if there are enough motile sperm in it. And then if everything is okay, the sample is frozen in several portions and then stored in a sperm bank. In the sperm bank, it can then be kept for many years and used later for an artificial insemination. In those cases in which sperm collection through masturbation doesn't work, then sperm can also be taken directly from the testicular tissue. This procedure is called testicular sperm extraction, or TEC for short. Yes. In this procedure, several small pieces of tissue are taken directly from the testicle during a minor surgery. This is done under general anesthesia, so you won't feel a thing. Sperm can then be extracted from the tissue in the laboratory and deep frozen. However, this requires an authorized practice or center and some time, both for preparation and for the procedure and recovery afterwards. Therefore, this method is only an option if the start of cancer treatment can be delayed long enough. Since it is a surgical procedure, there can of course be side effects, yes, such as pain or bruising. But these symptoms usually go away after a few days. And with that, we've already summarized the most important points. And we hope this brief overview will help you to start a conversation what might be the right option for you with your treatment team. Because as you've surely noticed, when it comes to this topic or the topic of fertility preservation, there is no one-size-fits-all. And it's important that you get good advice about what options are available in your case and which of them really fits your situation. And it's not just medical advice, because after all, it's not that easy when you have to deal with such weighty questions as wanting children later in life at such a young age. That's why the clinic's psychosocial team is also there for you and has an open ear for everything that's on your mind. So check out our video on how the psychosocial team can help you. There you can find out more.